Hello, my name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine specialist who works primarily with shoulder, elbow, and knee injuries. And today I want to talk a little bit about tennis elbow and one of the newer technologies that's available for the treatment of tennis elbow. For those of you that are wondering what exactly tennis elbow is and whether or not you have tennis elbow, I'll just go over a couple of the symptoms that people will usually display when they come into the office. Once again, this is a right elbow here. This is the anterior aspect of the elbow. This is what we call the medial side, and this is what we call the lateral side out here. The lateral side has the epicondyle, which is this bone here, and a lot of times you can palpate that bone directly if you just bend your elbow and just feel the little prominence over here on the outside of the elbow. If you have a repetitive activity such as lifting, or if you're locking your wrists, or if you're at the gym and you go out there and you do these flies and you got to keep those wrists locked, and you start developing a lot of lateral elbow pain, these are typically symptoms associated with tennis elbow. Or if you go out and play a lot of tennis and you get pain with the backhand, any activity where you got to lock your wrist and you do a repetitive activity, that can irritate this common extensor tendon insertion site here. So typically, if a patient will present, a typical patient will present in the office complaining of maybe 2 to 3 months worth of pain localized to the outside elbow, point specific pain. Typically, if they touch this bone, it hurts. If they lift their wrist up, it hurts. If I hold their wrist and they try to lift up with resistance, it hurts, and it's isolated to this lateral epicondyle. There's a really good test also called the piano key sign that we do in the office, where you extend the fingers and you push down on this middle finger right here, and it gives you direct pain in this lateral epicondyle. And the reason is that extensor carpi radialis brevis, or one of the extensor tendons here, inserts right there at the base of that second metacarpal, so you can kind of isolate that area. Typically, we'll try things like a counterforce brace, a good stretching, strengthening program, as well as anti-inflammatories, injections, or even sometimes a topical anti-inflammatory. You want to make sure that there's also another pathology you got to be aware of, or diagnosis you need to be aware of also, that some people tend to, or some doctors tend to overlap with lateral epicondylitis, and that's something called radial tunnel syndrome. So if you have that isolated pain here, more than likely it's a lateral epicondylitis or tennis elbow. Now, if the pain is more ambiguous and vague and tends to be over here in the forearm area, and tends to give you a little bit more tingling or numbness in the top of the hand, extending to the fingertips, that's more of a neurologic issue, and that actually has to do with a pinched nerve that goes in deep into this forearm area. So that is called radial tunnel syndrome. Sometimes you can even tap that area and feel like a stinging, or almost like a nerve sensation going down that forearm region, or the top of the forearm area here, and that is a completely different diagnosis. It's a completely different treatment for that. But if you do have the symptoms associated with tennis elbow, I definitely recommend to have it evaluated. Make sure you're doing the right treatment. Make sure you're doing the right physical therapy. Make sure you got the right counterforce brace. A lot of the braces that you buy over the counter are pretty straightforward, but you got to know how to put it on, and you got to know where to put it on. Typically, we recommend putting it on about a thumb's breadth below where that pain is, and that usually helps unload that tendon so the tendon can actually heal. Typically, if you have tennis elbow pain for 3 months to 6 months, that's when it's termed as chronic tennis elbow, and you definitely want to be evaluated and see an orthopedic specialist just to get the diagnosis, and also to see exactly how bad that tendinosis is. Sometimes you can have a severity of the tendinosis that actually involves not only the tendon, but it actually goes into the lateral collateral ligaments, which are the ligaments that help stabilize this lateral aspect of the joint. So if it gets to that point, then it becomes more of a complicated solution, where this type of option may not be a good option for that patient. However, for those specific patients that have tendinosis or degeneration within the common extensor tendon, this procedure, it's called Tenex, is a very good procedure. The idea behind Tenex is to use a smaller incision than the typical incision for an elbow scope, which is one of the options we do for tennis elbow, and definitely a smaller incision than an open debridement of the lateral elbow. This is actually what we call a micro incision, where we make a small poke hole or a small little poke hole or an incision into the lateral elbow and identify the degenerative tendon and the tendinosis with this little pinpoint needle here, and specifically debride that area of tendinosis, removing the pain generating tissue. The benefit of this is that you're preserving all the healthy tissue around that area, and you're specifically going after the diseased tissue. And we do that by identifying it with ultrasound guidance. So I drew over here a picture showing you exactly what the elbow looks like and what we're seeing with the elbow. This again here is the elbow, looking at it from the anterior aspect. This is the lateral side. These are the common extensor tendons coming up here in the lateral epicondyle, and then usually you'll get the degenerative tissue right here at the what we call the extensor carpi radialis brevis, which is this tendinous insertion here in the lateral side of the elbow. That extensor carpus radialis brevis actually is underneath a healthy layer of fascia and soft tissue. So it makes it very beneficial to be able to go in there with these micro incisions and this pinpoint accuracy with this little device and find this little area here with ultrasound and just debride it. And the beauty of this device is that it not only debrides the degenerative tissue, but it also irrigates it and sucks it out. So it not only just debrides it, but it actually removes it at the same time by sucking it out and removing it at that site. So we'll evaluate it in ultrasound, and we actually debride that whole area. This here is a larger picture showing you the tendinous insertion. This is the capitellum or the lateral epicondyle. Once again, that degenerative tissue is right here. With the needle, we go in and debride extensively. And looking at it from a side view here, the radiocapitellar joint, once again, they're the common extensor tendons that are responsible for the repetitive activities of the wrist and extension. Here, we go in there and we actually find this area and actually debride that area where the tendinosis is. This is the console itself here that actually gives us the setting and the cutting power for the device. With this specific device, it's nearly impossible to damage the healthy tissue because it only really breaks up the degenerative tissue because of the ultrasonic frequency. It actually vibrates and actually creates a fragmentation of the diseased tissue, whereas the healthy tissue doesn't respond in the same way. So that's where another benefit that this comes into play. This is also a quicker procedure. It takes about 20 to 30 minutes. Sometimes you can just do it under local, where you just kind of use a little conscious sedation and numb up the area. We typically prefer to do it in a sterile environment, but some doctors are probably using this in their office as well. One of the questions we get about tennis elbow involves what happens if you ignore tennis elbow. Okay, so tennis elbow is a chronic thing. I mean, people have had it for months. I mean, when it comes down to 3 to 6 months is when you start thinking you need to see somebody to get the diagnosis and the right treatment. Well, what happens if you don't and you just continue to live with it? Well, you start to notice a lot of weakness, some swelling. The problem is that the tennis elbow is due to the extensor tendons here, the tendinosis from the extensor tendons that insert on the lateral aspect of the elbow. So if you look at the muscle here, it inserts right here at that lateral epicondyle. The problem is that there's also some ligaments that come down underneath here, underneath this lateral epicondyle, that help stabilize the elbow joint. In the model here, you can clearly see these ligaments here. They go from the lateral epicondyle, they sweep underneath this radial head here like a hammock and kind of support this radial head. It's called this is called the lateral ulnar collateral ligament, and then you also have the radial collateral ligament up here. So you have two important ligaments here at the lateral aspect of the elbow. So what can happen over time is that you can get some degeneration of these tendons, and let's just say these tendons start to get torn and they degenerate and they become fibrosed or degenerative and torn. sometimes these tears can propagate and they can extend down into the collateral structures, which are the ligamentous structures of the lateral elbow. If somebody falls and lands on their elbow, and then let's just say they have some pre-existing tendinosis or degeneration of those tendons, and maybe even a partial tear of that lateral collateral ligament, that becomes a bigger deal, and that can lead to instability across the elbow joint, because once you lose those lateral ligaments here, this radial head here will pop out of joint, and that leads to what's called posterolateral rotatory instability. And so you typically do not want to, if you've had this for a long time and you're starting to notice some, the symptoms for posterolateral rotatory instability is popping, snapping with rotation of the elbow, pain when you're doing a push-up or pushing up. You'll feel like a clunk sensation on the lateral aspect of the elbow. That means that this bone here is sliding out because it no longer has the structural support here. So if it gets to that point, that is something that cannot be treated with something like the Tenex. It cannot be treated arthroscopically, although there's one technique that does describe a tightening of these structures arthroscopically, and usually they're treated with an open procedure. And if it's really chronic and has been going on for a long time and that lateral and the collateral ligament is just completely torn and retracted, sometimes we'll have to do a reconstruction of that ligament and actually reconstruct this whole area with a graft. So from going from point A to point Z, there's a lot of different steps to take into consideration when it comes to tennis elbow. The first step being that get the diagnosis early. Number two, make sure to start engaging in the preventative activities that you can do to kind of protect that elbow, at least during the healing phases. And number three, making sure that you do not ignore a mechanical issue in the elbow, such as a clunking, popping, locking of the elbow joint, especially if you have a pre-existing history of tennis elbow. But I just wanted to do a quick video just showing you the benefits of using the Tenex procedure. There's more information on this on our website. To look up more information on the Tenex procedure that we're offering in our offices and at our participating surgery centers at this time. Thank you.